As people approach their 50s, everyone makes these common mistakes. To correct aging with quick fixes like Botox and fillers can lead to unnatural results or even long-term issues. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon. Here's a breakdown of common mistakes people make with facial rejuvenation in their 50s and more thoughtful alternative options. Common mistakes. Overuse of Botox. So what happens? Too much Botox, especially in the forehead, can cause muscle atrophy, which is wasting of the muscle, and so you lose the plumpness and the natural expression, so you get a flat and heavy brow over time. Why is it problematic? You get a frozen look, it disrupts the facial movement, affects the expression of emotions. When you lose the plumpness and you lose the ability to express yourself and you have that flat appearance, you tend to look a little bit older than you actually should do. So there are lots of people who are kind of in their 20s and 30s who have been using Botox since their late teens, and they actually look a lot older than what they are. This is one of the dangers of Botox. The other thing Botox can do, it can drop the muscles, which is what it's designed to do with the paralysis in the forehead. And as it drops the eyebrows, it gives you a more tired look. And that's something that you really should be careful of with overuse of Botox, particularly as you get older. Excessive fillers. What happens? Attempting to lift saggy skin by adding volume in the cheeks and the under eyes and jawlines or lips. It can be problematic because fillers don't replace a surgical lift. Over time, the overfill looks unnatural. You get a pillow face and you tend to look the opposite to what you intend to look like. There's this common misconception that if you use Botox and fillers early, you will stave off the effects of aging and it will make a facelift or any surgical procedure easier. This is not the case. When you overuse your fillers, it can actually make a facelift a lot more difficult. It can distort the planes between the layers of the face, which can increase the risk of complications, and it can slow down the procedure. And in a lot of cases nowadays, facelift surgeons may even refuse to do a formal facelift if you've had lots of non-surgical treatment in the past, just because the risks are way too high. Chasing every new device or treatment. Getting tempted to every new skin tightening machine or laser ultrasound device is problematic because not all machines deliver the visible results and many offer only modest improvement. The problem is lots of institutes buy and spend hundreds of thousands of pounds on these machines, and their aim is to use the machine to make it worthwhile rather than speak to the patient and decide what is the best for them. So it's really important to speak to a surgeon or a specialist who is able to give you the correct advice, not there to sell a machine. Ignoring the big picture. People focus on wrinkles and individual lines of the over and forget the overall facial harmony and the structure, believing fillers and Botox will replace surgery. I would also focus on skin quality treatments, making sure that your lifestyle is balanced, you're well hydrated, and focus on use medical evidence-based products such as retinoic acid and vitamin C. The only way you will be able to know whether there is something medical evidence-based is if you speak to a medical professional, and they will give you the best advice, and also they will bring their own experience into it. Energy-based devices are useful, and when you speak to a medical professional, they will advise machines that they have experienced and they have evidence to show that it works. With all of these things, the results are gradual and preventative rather than transformative, so you have to be patient with the process.